Hello guys, my name is Akshi and welcome to my YouTube channel. I hope you all are doing well and I hope you all are very happy. Okay, so now today I'm with a new topic, that is mucogingival surgery or the periodontal plastic surgery. It is a very interesting topic. It is one of the most favorite topic of mine. Basically the questions asked is what is gingival recession, what is the definition, what are the methods how we can reduce the gingival recession or the procedures of root coverage, and what is mucogingival surgery, its aims, its objectives, and the most important graft is asked, that is the free gingival autograft. They are the most important questions. Now let's proceed. What is gingival recession? The definition says gingival recession is defined as exposure of the root surface due to the apical shift in the marginal gingiva. Now there are two types of the gingival recession. First is visible and second is hidden. Visible is clinically observable and hidden is covered by gingiva. Now what is the classification? Now there are two classifications. The first classification is according to Sullivan's and Atkins, and second is the P.D. Miller's. So according to Sullivan and Atkins, the classification there goes shallow, narrow, shallow wide, deep narrow and deep wide. According to P.D. Miller's, the classification is divided into four classes: class 1, class 2, class 3 and class 4. In class 1, the marginal tissue recession that does not extend to the mucogingival junction and there is no loss of bone or the soft tissue in the interdental area. Class 2 states that marginal tissue recession that extends to or beyond the mucogingival junction and there is no loss of bone or soft tissue in interdental area. In class 3, marginal tissue recession that extends to or beyond the mucogingival junction and there is loss of the bone or soft tissue in the interdental area or there is the malpositioning of the tooth. Class 4, marginal tissue recession that extends to or beyond the mucogingival junction with severe loss of bone and soft tissue interdentally with severe tooth malpositioning. So this is the classification of gingival recession. So now let's talk about the etiology of gingival recession. First are inflammatory factors, which includes plaque-induced inflammatory periodontal diseases, including the toothbrush injury and etc. Anatomic factors include developmental anatomic abnormalities like high frenum attachment, shallow vestibule, etc. Iatrogenic factors involve the deleterious habits, that is pressure of foreign objects like fingernails, pencils, hairpins, then clasp and mandible, oral denture, bars, and prolonged orthodontic treatment. Now let's talk about the treatment. Now various techniques are there to increase the width of the attached gingiva. Okay, these are the root coverage procedures. So gingival augmentation apical to area of recession and gingival augmentation coronal to the recession. Now gingival augmentation apical to area of recession include the free gingival autograft, free connective tissue autograft, apically positioned flap fenestration and vestibular extension. And gingival augmentation coronal to recession or root coverage includes free gingival autograft, free connective tissue autograft, pedicle autografts that are two, rotational and advanced. Rotational includes lateral pedicle flap and advanced includes the semilunar flap. Then subepithelial connective tissue graft, subpedicle connective tissue graft, pouch and tunnel technique, envelope technique, and GTR, that is the guided tissue regeneration. Okay, now let's talk about the mucogingival surgery. Now according to the definition, they are the periodontal surgical procedures which are designed to correct the defects in the morphology, position and or the amount of the gingiva. What are the objectives of mucogingival surgery? First is widening of the zone of the attached gingiva. Second is coverage of the denuded roots. Third is removal of the aberrant frenum. Fourth is creation of vestibular depth when it's lacking. Fifth is as an adjunct to routine pocket elimination procedure. Indications: augmentation of the edentulous ridge, crown lengthening, prevention of ridge collapse associated with tooth extraction, loss of interdental papilla which presents as aesthetic defect. What are the contraindications of mucogingival surgery? In patients of advanced age, patients with systemic diseases, cardiovascular disease, liver disease, blood disorders, malignancy, and in presence of infection, and in cases where the prognosis is poor. Now let's talk about the most important question that is asked in the university examinations in periodontology paper, that is free gingival autograft, and in which comes the classic technique, variant technique and accordion technique, but I would like to discuss in detail the classic technique. Now it involves so many steps. Now let's see one by one. Step 1 is the elimination of the pockets. Now you can see over here that the pockets are being eliminated. So it states that if pockets are present, eliminate them by resection with the gingivectomy incision, do scaling and planing of the root surfaces. Next is step 2, preparation of the recipient site. that is the recipient site, it should be outlined by 2 vertical incisions with number 15 BP blade to a little more than desired depth, and recipient site should be outlined by vertical incisions from the cut gingival margin to oral mucosa. Excision should be extended to a desired width of attached gingiva. A number 15 blade is inserted along the cut gingival margin and separates a flap consist of connective tissue and epithelium without disturbing the periodontium. Tin foil template placed at the recipient site. So in this case, now over here you can see that with the number 15 BP blade, we need to give 2 vertical incisions, and that vertical incisions should extend from the cut gingival margin till the oral mucosa, and it should be extended to the desired width of the attached gingiva. And we need to raise the flap, and that consists of the connective tissue and epithelium without disturbing the periodontium. And then we will place a tin foil template. See here, tin foil template adapted on recipient site. So a tin foil template, we need to adapt it on the recipient site. Now let's proceed to the step 3, that is obtaining graft from the donor site. Now we can obtain the graft, basically the areas for the donor site are attached gingiva, masticatory mucosa, and from the edentulous ridge and the palatal mucosa. So generally a partial thickness of the graft is used. Now the graft should consist of epithelium as well as the thin layer of underlying connective tissue, and then a tin foil template is placed at the donor site and a shallow incision is made over it from number 15 blade. The blade is inserted to the optimal thickness at one edge of the graft and is elevated by holding with tissue forceps placed at the margin of the graft. Ideal thickness of graft is between 1 and 1.5 mm. As graft is separated, the loose tissue tags all are removed from the undersurface. Now, basically what is done, that donor sites are what? From where the graft is obtained is the attached gingiva, masticatory mucosa, from the edentulous ridge and palatal mucosa. Okay, so partial thickness of graft, and the thickness should be between 1 and 1.5 mm, and generally a tin foil template is placed at the donor site, and we will just make a shallow incision. Now what do you understand by shallow incision? Shallow incision means just like outlining those area. We need to make a shallow incision, and then what we need to do is you have seen in your school time, those stickers we were using just to write our names on it when we buy new notebooks, and just will put the cover, and we used to place those stickers. So how we will peel that stickers, or how do we remove that stickers from our notebook? So by just we will hold it at one edge and then we will peel it off. So like the same way, the blade is inserted to optimal thickness at one edge of the graft and then slowly elevated by holding with tissue forceps, placing at the margin of the graft. So now over here the tin foil template is placed on the palatal mucosa, the donor side, and see over here we can see that how it is generally by the tissue forceps it is elevated by holding it at the margin of the graft. Now let's talk about the fourth step, that is transfer and immobilization of the graft. In the step 4, first we need to remove the excess clot from the recipient side because thick clot interfere with vascularization of the graft. Then the graft is immediately transferred to the recipient site and immobilized by suturing to the periosteum of adjacent attached gingiva with adequate number of restorable sutures. Exert pressure against the graft for a few minutes to eliminate the thick blood clot between the graft and the recipient bed. So over here we can see that the graft tissue is sutured on the recipient side. So the graft is obtained from the donor side and then it is sutured on the recipient side. For that we need to remove the excess clot from the recipient side because thick clot will interfere with vascularization of the graft. Now what is step 5? That is protection of the donor site. Cover the donor site with a periodontal pack for 1 week and repeat if necessary. Then modified Holly's retainer is useful to cover the pack on the palate and cover the edentulous ridges. Now over here you can see that periodontal pack is placed on the donor site and healing of the recipient site. So in this case also we can give later on instructions to the patient. That is, the patient should not brush his or her teeth for at least 2 to 3 days, and the patient should not brush the area which is in which the surgery has been performed, and even he or she should avoid smoking and etc. I hope you have liked my video, and please do not forget to like, share and subscribe. Thank you.